Most of the population is still sensitive to the virus and can be infected.
New at 11, a UC San Diego professor with decades of experience studying viruses claims we're not out of the woods yet. Our 10 News reporter Cassie Carlisle spoke with him today about what he says needs to happen to end this pandemic.
Professor at UC San Diego Stephen Hedrick specializes in disease.
This last fall in 2019, I taught a class on the history and the biology of plagues.
Right now, the pandemic has his lab pretty much shut down.
It would be great to be in the lab now and be able to test some vaccines.
Hedrick says vaccines and antibody testing are the key to eradicating this virus.
If they just test for the virus, that only tells you whether you have an acute infection. But if they test for antibodies, that says whether you've ever had the disease.
Saying the death toll lags behind COVID-19's rate of spread.
It takes about 4 days of incubation before you feel any symptoms, another 10 days before the symptoms become severe, and then, in the worst case scenario, another 2 weeks perhaps before death.
While San Diego's death rate has steadily inclined, over in LA, they saw their highest spike on Saturday, 81 lives lost. Hedrick says we may be on the downhill when it comes to the spread of the disease, but we don't have nearly enough data to support it.
We'd like to see a couple or 3 or 4 weeks, after the death rate starts to wane, before people start to think that the incidence of disease has gone down.
Social distancing important more now than ever.
As long as there are people who are susceptible to the disease and we don't have widespread immunity by vaccination or because everybody's had the disease, there's always the possibility that it's going to come roaring back.
Cassie Carlisle, 10 News.